I'm Kaylee Grievenow, a media intern at the University of Iowa's Public Policy Center. Today I'm talking with PPC Director Peter Damiano, whose research deals with questions related to health insurance coverage. Thanks for joining me today, Peter.
Thank you, Kaylee. It's a pleasure to be here with you.
Could you explain a bit of your work at the PPC and what motivated you to start it?
Sure. I've been working in the area of health insurance coverage, as you said, for basically my entire career. I did my graduate work out of UCLA and Rand, and I was fortunate enough to have as my research mentor, Dr. Rick Brown, who at the time was one of the nation's experts in health insurance coverage. And that was one of the reasons that sort of sought him out as a potential mentor. And so he was looking at health insurance rates of the uninsured, options for health insurance coverage. Unfortunately, 30 years later, still questions that we are looking into and still very important questions for people in the United States.
So how do you see this work serving the University of Iowa community, maybe the larger state of Iowa community?
Sure. Within our health policy research program, we've done a number of studies with the State Department of Human Services and the Department of Public Health, evaluating state insurance programs like Medicaid programs. We've also looked at the health insurance coverage of children and families many times. And so this information then gets fed back to state policymakers as well as the public, and really helps to try and inform policymakers to make better policy, understand what the questions are, and understand the problems so that they can try to address those.
And now, of course, where the past several months have kind of been upended by the coronavirus pandemic, how has that altered the way maybe you think about going about your research, or how that has altered the recommendations that you're finding now with this kind of new health crisis?
Sure. So in recent period, like in the last 10 years, we had the Affordable Care Act, which expanded health insurance coverage for about 20 million people. When the COVID-19 crisis hit, we know that there are many people that lost their jobs nationally. About 31 million people went on unemployment in just March and April. And it's been estimated that of those 31 million, about 27 million or so may have lost their employer-based insurance coverage. And so then the question becomes, what are the options for the people who do lose their employer-based insurance, whether it's on a short-term or a longer-term basis? Some of those things go back to the Affordable Care Act. So there were a number of changes that were made that allowed states, for example, to expand their Medicaid program, which Iowa did. So now low-income adults up to 138% of poverty have an option for health insurance that they would not have had before. Another one is through what's called the Health Insurance Marketplace, or what some people think of as healthcare.gov. And for people from 100 to 400% of the federal poverty level, they're able to buy subsidized private insurance as an option if they lost their employer-based health insurance coverage. Another thing that came out of the Affordable Care Act. There's a couple of other things that have been in place. One in particular is something called COBRA, which is a way for people who lose their job, who are then able to then buy the same insurance that they had before, but they have to buy it without the employer's subsidy. So employers in the United States get to write off the cost of the health insurance on their taxes for larger employers. And so they generally subsidize the cost of the health insurance for their employees, although more and more they're pushing those costs onto the employees. But that's an option for people who might lose it, but it's very expensive. For the average policy for an individual to buy COBRA is about $7,000 a year, and for a family of four is over $20,000. So if you can get into the Medicaid or Medicaid expansion portion, which in Iowa is called the Iowa Wellness Plan, we also do the evaluation of that program at the Public Policy Center. That's a great option. And then the Health Insurance Marketplace is really another. The last one is what are called these short-term health plans. And it's something that have been expanded in the last few years under the Trump administration. They tend to be a little less expensive than some of the ACA compatible plans, they're called, because those things cover basically everything, and also will cover people with pre-existing health insurance, health care problems. These short-term health plans often are very limited in what they will cover. They may not cover someone with a pre-existing health condition. And if it's found out that you have one while you have that policy, you may be denied coverage for that portion of a health insurance event. So they are something that's sort of better than nothing, but something that people have to be really careful about if they're looking at that as a long-term solution.
How do you see your research, or what you are kind of expecting to find in what we are kind of now referring to as a post-COVID world, hopefully in whatever time frame that is of when we're able to kind of move past this weird phase in our lives? How do you see the post-COVID world kind of changing how you go about this health insurance coverage research?
Well, I would say even before we get to that post, there are still really important questions. For example, what's going on with the health insurance coverage currently of people in Iowa? So even though we know nationally we have sort of a rough idea of how many people have lost their employer-based in coverage, we don't have a real good sense of how many people were able to pick that up elsewhere. Similarly, something we're going to be looking at soon is doing a survey of Iowans and looking to see what effect they had on their employment, and then also what effect that might have had on their health insurance coverage, so we can share that information with Iowa policymakers and the public to be able to understand what they might be able to do to help with that situation moving forward. Post-COVID, if you will, the question then becomes, even with the Affordable Care Act, there are still about 25 million people in the United States pre-COVID data who didn't have health insurance coverage for a variety of reasons. Either they're in a state that didn't expand Medicaid, for example, and they're in their insurance gap, or they're undocumented and they don't have access, or they're in a small business that doesn't offer benefits and they're, for whatever reason, aren't eligible for one of the types of coverage. So there's still a lot of the gaps that we need to really pick up if we want to make sure that everyone has financial access to healthcare in the United States.
All right, great insight and answers from our PPC Director, Peter Damiano. Thanks again for chatting with me today.
Thank you, Kaylee. It's been a pleasure talking with you.
For more information about the Public Policy Center, our work, and researchers, you can visit us at ppc.uiowa.edu.